Good morning. Let me introduce myself. My name is Felos Kaloterakis. I am the chairperson of the newly founded section of ISSUP in Greece, and I am also a director of KITHE, and I'm also under my capacity as the president of the board of Sirius, Sirius being the Center for the Prevention under the auspices of the municipality of Salonika, hosting prevention programs, also with the cooperation of Okana. I'd like to thank some persons, first of all, starting with the board of directors of Sirius. These persons were those who made it possible for Sirius to undertake this initiative and launch this section in Greece. It is a part of an international network of professionals. It's a network that also welcomes volunteers somehow involved in the world of addictions. I'd like to thank Lina Provatsis, vice chairwoman of the board, Yannis Vasilakis representing the staff, Evgenidis representing the College of MDs, as well as other persons representing the bar of Thessaloniki. I would like also to express my appreciation for having once again been of assistance to the hosting of the whole event, Mrs. Vicky Papadimitriou and Maria Stroumeno. I'd like to thank Mr. George Fasoulakis, the interpreter. Thank you, George, for being here. I thank you for bearing with us. George has been cooperating with us for several years, and anything having to do with addictions has been in George's lips, so much that he might also be a speaker. Thank you once again, and I thank the audience for that. And of course, Alter Global, I'd like to thank all persons for being here and those who are unable to attend. I'd like to thank Mrs. Fitzpatrick. Kirsten, thank you so much for being here. And I'd like to also thank Olivia Woodrow for being of help in making it possible for the whole event to be hosted and for the official launch of the Greek section, the Greek chapter. The floor goes to Olivia. She will be providing some technical information about how to use this panel. Olivia, the floor is yours.
Thank you. Just to cover a few technical housekeeping points before we start. If you would like to receive or access the simultaneous interpretation for this event, the instructions are in the chat box, and you should have been able to see them. Please could you click on the Interactio link. You can open that in another web browser or on another device like a phone or a tablet. And then please enter the event code, ISSUP Greece Launch, and then select whether you would like to hear the English or the Greek channel. Once you're connected to the audio on Interactio, you can then disconnect from audio on GoToWebinar and select no audio in the control panel. So you can listen to the audio for the whole event on Interactio in the language of your choice. So that is everything from my end. If you have any questions or problems, please message and we will try to assist you. Great, thank you.
Thank you, Olivia. Thank you for everything, not only for these housekeeping rules, but for everything, for all your assistance so far. Thank you. It is appreciated. Είμαι ενθουσιασμένος γιατί ξεκινάμε ουσιαστικά στην Ελλάδα ένα δίκτυο.
I'm thrilled because here we are starting in Greece a network at a time of isolation and solitude. This is in itself something very valuable. It's a network of local as well as part of an international initiative. So this is the possibility given to us when it comes to training and research to exchange experiences so that we here in Greece, versed as we are in addictions, to be able to exchange with our colleagues from elsewhere. We'll see how things fare in due course. Today is the official launching of the event, of the whole initiative. It would have been different had we been physically present. Hopefully this will be done when once again we'll be able to meet. In the meantime, there will be webinars and there will be a training module. Indeed, if I may use a basketball term, it's an all-star team we may rely on, because these are people that have truly proven to be very valuable in this effort. Let me introduce to you the members of the Board of Trustees of the Greek chapter of ISSUP. Apart from myself, Stelios Giuseppas. Stelios, I don't know whether we can see him. He is the scientific the scientifically responsible person in this initiative. He comes from the Argo module in Thessaloniki. Natalia Zakhardzi, she is the scientific directress of the Sirius module. Dr. Kovatsis is a assistant professor and head of the laboratory for judicial psychology at the University of Thessaloniki. Mrs. Anna Tsiboukli, Dr. Tsiboukli, is a psychologist and deputy editor of the Addictions Review and training head at Kethea, and Yulia Buffy in charge of the reduction of harm. I'd like to thank them all, because what has been happening now is something that would never have happened unless we all join forces. And that's what we're doing. Thank you all for being here. Although they refused to take the floor and say something about themselves, they may be very demure. It's for saving time that we don't give the floor right now, but they're all wonderful people. I'd like to read the text of the official address by the mayor of Thessaloniki. It is very good for this to be read. Let me read into the text of the address by Konstantinos Zervos, mayor of Thessaloniki. Ladies and gentlemen, it is a pleasure for me to take the floor when I learned. I'm sorry, the sound is problematic. I can hear myself. This is an interpreter. I cannot.
Ακούμε και κάποια άλλη φωνή. Εγώ τουλάχιστον ακούω. Είμαστε εντάξει. Συνεχίζω.
No. So I'm twice as happy because this beginning finds us all together at starting point through the presence of the mayor of Thessaloniki in the Center for the Prevention and the Promotion of Psychosocial Health of Sirius. In reading into the theme of today's seminar, I understand that the pandemic has a variety of impacts on public health, not just about the infections of the upper respiratory system. It is a complex phenomenon that has happened and changed our lives forever. It has been disturbing very profoundly our day-to-day life, and restrictions, limitations, social distancing measures, unfortunately, come with a cost, not just benefits. Financial cost, as we all understand, and because we've been suffering from that, but also psychological cost. Mental health is something that suffers, and we need to see into that. When for the first time we understood that there is an increase in the use of substances worldwide, we understood how complex the problem is and how immense the challenge and the need to deal with this. New facets have come ahead, and we need to focus on them both as a community and as an organized government. And here is where your role becomes important. ISSUP's role. The establishment of a network of professionals in the sector can only be beneficial, upgrading the quality of services rendered, as well as creating a channel of communication and exchange of expertise, experience, practices, as well as research findings. Your role is that of a leader. You are on the front line of efforts towards dealing with such very burning issues: prevention, therapy, treatment, training. We may not close our eyes to the problem, nor to pretend that there is none. It is a visible problem, and we need to organize ourselves as how to overcome it. Today, against a networking backdrop, the creation of a spirit of international union is something that goes hand in hand with the developments. It has been always an advantage, networking. We, as the mayor of Thessaloniki, with all our forces from the onset, from the very first case of coronavirus, we started waging an effort. The protection of public health is the ultimate goal, and that's what we have been doing through the relentless operation of social modules, services, and other centers. With these thoughts, let me wish you the best of success to today's event. Other engagements previously made did not make it possible for me to personally attend this launching event, but you may be reassured that I have been following your activities very closely, and I am prepared to follow up your activities, listen to your proposals, and be of help in this effort. Thank you very much for your attention. And we thank the mayor for this very helpful attitude for all these years, and because of having been so supportive. It is a pleasure and a honor for us now, and to me it is something exquisite to be the head of something because of the example. We have the national coordinator by the Prime Minister, Mr. Konzidis, and it is very important to hail the presence of so high-ranking an official. Thank you very much, Christos, for being here. Your presence is highly symbolic. It's a pleasure for us to have you here with us. Mr. Konzidis, I would like to elaborate in Greek because this is a Greek event. I would like to thank you for the invitation. Of course, I'm a proud member of your association, and this initiative comes indeed at a very timely, historic, should I say, moment. May I say that given Greece's policies in the matter of addictions, this is the right moment. From the onset of the COVID pandemic, we said we will not allow COVID to be an excuse for actions and activities and initiatives to be paralyzed, not after so much effort waged in the domain of addictions. And indeed, together with my colleagues, we realized how risky it was for all these problems faced by substance users to be paralyzed. I'm being very careful with the way I use terms. I'm not classifying people by reference to their problem. I'm not speaking about addicts or substance abusers. I'm speaking about citizens, fellow citizens of ours who have a problem with alcohol or substances. It is very important to use the right terms because the way we refer ourselves to something also determines our approach of things. So, taking on from what Mr. Mayor said, just as with any other critical issue, the agenda of problems of people having substance use issues might be paralyzed, and this is something that is happening worldwide. We see this happening sometimes in Greece also, when it comes to the shrinking of services made available to people who have been HIV positive, diagnosed, and also have a substance use problem. So there is also a blatant example of how COVID and our effort to come to terms with it has been opening wounds amongst people in sensitive social groups, difficult to heal, as it became apparent through research carried out worldwide about the impact of COVID upon our population. These are collateral damages. These are indeed damages suffered in a collateral way, and we have to also weigh them. Now, what is it we have accomplished during the pandemic, and what it is we may quote when it comes to dealing with addictions in Greece? We have been able to develop a national strategy at a difficult moment because it was something we were lacking, and over the period 2021-2026, and a national plan for 2021-2023. There is a need for this strategy to happen. It provides a context. It is a context we have agreed upon, all of us, something we can refer to every time there is an issue, and a context we should have as a compass when, on the basis of international standards, the level of scientific research goes up and higher. We have accepted worldwide that our approach, the whole debate, should rely on scientific documentation. And scientific documentation stems from the assumption that science may only approach truth. It may not express it 100%, literally. And as scientists, we have accepted to also be open to an opposite opinion, so as to conjugate everything in a synthetic solution that would be highly complementary to whatever is done worldwide. This is a context to help also all of us professionals dealing with the issue, coming from the world of harm reduction, as well as the domain of the reduction of demand. In so doing, and by addressing ourselves to all specialists, we'll try to overcome our differences of the past and rather go down a path of cooperation. Our goal is common. We are trying to manage on the short run, mid-term, and on the long run a very serious problem. So let us try and provide solutions to very real issues having to do with the human nature. And indeed, ours is a very important role. We are complementary to many other things. It is important to be able to speak to the Greek community using a tongue that is not subversive nor conflictual. This is not what we're looking for. The social stigma and the social isolation suffered by our fellow citizens facing problems with addiction and use is very much present. More often than not, a positive orientation towards reducing the stigma could translate in something very positive, and we see how easily this may happen when there are efforts carried out in a concerted way for serious issues to be dealt with, as is the case of homelessness in the major cities and metropolises, and especially in the center of Athens. Then do we see how easy we can also deal with such issues as negative reactions by our citizens for lack of information or for want of empathy, or because some smaller social groups, minorities, are trying to irritate people and vex them. Training, therefore, and building on ISSUP's initiatives, we can have the extra step ahead. It is of paramount importance to build on training and also rely on the contribution of other professionals from other domains, colleagues, first of all, the MDs, the nurses, people from the world of health. We should all try to help one another. Sometimes what we do not know, we're afraid of, and we may become victims to denials. Well, rather, we should be training ourselves to learn how not to be afraid of things. We can do that by referring ourselves to the specialists. We can also open up by providing jobs to people who are graduating from our programs and just left marginalized because of sometimes even the government's neglect. And that stigma will be lifted, and this will be definitely the right direction to take. That is why I'm saluting ISSUP Greece's initiative, the Greek chapter. Let me also stress that Greece will be hosting in 2023 the International ISSUP Conference, International Society of Addiction Medicine. It will be hosted in Athens in November 2023. It is a major event to expect, and very soon we will be having concerted efforts also carried out by most of Greece's universities towards assisting in terms of training for professionals, health professionals, and other professionals. Thank you very much. Good luck in what you're doing, and I'm with you. Christos, thank you. We are those who express an appreciation. The pandemic has changed our lives. You're speaking of a conference in Athens, and it sounds so bizarre, whereas it should sound very normal. Hopefully, things will be getting back to normal very soon. Today, we rejoice in the presence of Okanas's president. It is the agency having the scientific supervision over the program and Sirius. I'd like to stress the importance of Mr. Athanasios Theocharis. I'd like to thank him. It is a pleasure for us to have you amongst us. You have the floor, sir. Mr. Theocharis has the floor. Thank you very much for the invitation. It is a honor for me to be able to assist the launching of so important an effort, and it is highly symbolic too, because only a year ago, when we undertook, or I undertook, the leadership of this agency, Thessaloniki was my first destination. My first trip was there for me to meet people from the Pedion and also field workers with who I spoke about issues of mutual interest. For us at the organization, is it very critical to see such stamina being developed, the momentum built towards such interventions, because it is really what is being buttressed and enhanced, whether we are heads of agencies or people who just want to be contributing to the effort against addictions, exchanging in good practices on research and training, on knowledge and how it can be further diffused and transmitted, differentiated or better focused, you name it, on things that are of higher importance in a more systematic way, whether issues relevant to our day-to-day practice or questions leading to food for thought. Whatever we do should be fitting into the development of new initiatives. I will be fully endorsing what our national coordinator said. It is a very happy conjuncture under the circumstances. Very soon shall we have the national plan, our national strategy will be put in paper and implemented. And to complement what he said, I will say that against a panicky background we found ourselves as a country or as agencies, we still were able to develop a focused action plan towards dealing with the pandemic and ways to limit the propagation of COVID-19. And again, Thessaloniki proved itself to be a leader, because this city was the first to come up with a homeless shelter right on the premises of the trade fair of Thessaloniki. This may be quite telling. Maybe Thessaloniki is fostering better ideas, maybe the climate, I don't know, whatever the case. I'd like to say that the conjuncture is also happy, because here we are having in our hands a planning to develop modules under the financing of the European Union, now deployed gradually but steadily, and the first results are reapt. We at Okana may say that we will be benefiting from multidisciplinary centers for short-term sheltering, day centers, also ways to enhance our human resources by way of hiring new staff. These are but a few of various things happening in Greece. It is something very novel. Never in the past have so many different modules being developed so intensively, and we're speaking about Greece as a whole. This is not just Athens as the main metropolis or other major agglomerations of this national territory. We're speaking about many other areas in the country that are coming to cater to the needs of our fellow citizens, people who in the past may have been truly reticent in asking for help, or maybe they didn't even know where to turn for help. Sometimes those people had to travel 200 kilometers just to find help, and that made things very difficult for them. Now, here we are trying to make things easier for these people by providing services as close to their homes as possible and as close to their needs as possible. And obviously, practice as well as the knowledge of the specialists is really what has been inspiring us to support these people. So, in launching this network and having ISSUP here in Greece is one of the positive steps we should be hailing and invoking and putting forward under these difficult circumstances. Finally, are we in a position to say that Greece is no different from any other country? We're just as capable and just as much in a position to come up with good practices and know-how, and why not even diffuse these to other peoples, other professionals. Thank you very much for bearing with me, and good luck with what you're doing and your endeavors. It goes without saying that Okana will be next to you for whatever you may need. Thank you, Mr. Theocharis. I also have the urgent need to thank you for your kind words about Thessaloniki. I am a person of Thessaloniki. Wait and see until we have our subway system. It's a joke, but anyway. Thank you very much. Your presence has been honoring us, and indeed it has been encouraging us substantially under the circumstances. Let us go international now and have it from other people. Next comes a low-profile, excellent person, a person of high skills and with a gift in what he's doing. He's a senior executive officer for INL, the Bureau of International Auction Law of the Ministry of Foreign Affairs of the United States, as ISSUP, the global level, exists thanks to the initiative by the Secretary of State of the US. Bill McLean, you have the floor.
Go ahead.
I'm the one who's grateful. Thank you so much, Dr. Kaltarakis, and please, my respects to the distinguished members of the Greek government and the Greek demand reduction community, to the distinguished colleagues and other professionals who are here. I feel like I'm coming home a bit, Faydon. It's many years ago I was on what we call the country desk for Greece for the U.S. Department of State. So I had great honor and pleasure to work a lot with your colleagues and countrymen, and I know the high regard that we all have for you and what your efforts are. I've particularly had a chance to learn about the very innovative programs that you have in Greece for drug treatment and prevention. And I completely agree with Dr. Theokaris that we really were going to see continued great practices and ideas on how to reach populations and make the best training possible to everyone. We're also really very lucky to have a highly regarded Centers for the Prevention of Addictions and Promotion of Psychosocial Health, CERIOS, to be the lead organization to pull together this effort in Greece. And again, it's very clear from the participants here and the comments we've heard from the national coordinator and others, what a great job you've done in that regard. I should just say a word or two of what my personal and my organization's role is. I'm with again, as you mentioned, Faydon, I'm with the U.S. Department of State, our foreign ministry. I work in a part called the Bureau of International Narcotics and Law Enforcement Affairs. And what we do is support international cooperation in drug prevention and treatment. We believe strongly that illicit drug use is very serious and a global problem. And maybe even more importantly, we believe we're able to make progress by focusing on evidence-based practices that work. We think this is a question of learning from each other, what is effective, and I think the very strong organizations and individuals in Greece will make a great contribution in that regard. I should also mention a few words, which I'm sure we'll hear more from Joanna about the International Society of Substance Use Professionals in general. But let me just say that it's such a central partner to this whole effort. We see it as a home for practitioners and professionals in drug demand reduction, a place where they can get the best treatment and prevention training, where they can network, and that really they can basically teach each other and us how best to approach this difficult problem. Further, I think ISSUP serves as a place where not just the professionals directly involved in drug prevention and treatment, but everyone from just criminal justice workers, teachers, local and national government individuals, and others can play a part, which again, we think that's the only way to really address this very broad and serious problem. We also really are impressed with what the International Society of Substance Use Professionals has done during COVID-19. So many things have been restricted or shut down. ISSUP has shown itself to be a very effective online presence to continue and vastly increase the number of people we can reach. I know that many national chapters have held events like this and continuing events and been able to reach out to a much broader audience than we have in the past. And we really are very fortunate that ISSUP has been able to do that through a lot of hard creative work. We are absolutely certain the national chapter of Greece will have a great deal to offer. We've seen that already. I've personally had the benefit of getting to hear Dr. Faydun many times, and even share a couple visits where we enjoyed getting to know each other. But I think you're going to offer a great deal to all of us. And I think that the other 23 national chapters have been very active and a great resource. A good example of what has happened last fall, there was an extended series of webinars for Africa, which was highly attended. The ISSUP National Chapter South Africa played a big role. And I think we felt it was a very successful event that, again, reached out to that broad audience I mentioned earlier and gave a chance for you in particular, the experts in drug prevention and treatment, to share what you've learned and how we can address this problem. Let me conclude by saying that we are very grateful that the ISSUP National Chapter of Greece will share its impressive experience and skills in drug demand reduction, and we look forward to productive collaboration. Thank you very much.
We are grateful, sir. Thank you very much for your kind words. Thank you very much for all the support. And it is with much pleasure that we'll be giving the floor to the very soul of ISSUP Global, the Executive Director of ISSUP Global, Joanna Travis-Roberts. Joanna, you have the floor.
Please, Joanna, go ahead. The floor is yours.
Thank you, Faydun. Thank you. And thank you to you and ISSUP Greece for inviting me to speak today and be alongside such an esteemed panel. It was great to hear the words that we've already heard from, and I'm very much looking forward to hearing the rest of the presentations, the rest of today's webinar. So I'm going to just talk to you a little bit about ISSUP. Bill gave us a great introduction, and I'm just going to sort of go over some of that and talk about the role of the organisation. We are an international membership organisation, really very focused on supporting, developing, representing a professional workforce in the substance use prevention, treatment and recovery care field. We're delighted to have almost 18,000 members from around the world at the moment. And we really have a vision of a connected, trained, knowledgeable and effective international network of substance use prevention, treatment and recovery care professionals undertaking and promoting high quality, evidence-based and ethical substance use prevention, treatment and recovery support. So this, this intervention today and this initiative is really taking us a great step further towards that vision. I just want to reinforce something that Bill said, that when we consider this network, he described us beautifully as the sort of home for the workforce. But when we consider this workforce, when we consider the network, we really include all elements. We anticipate volunteers helping family members, those that have made it their lifelong academic study, those that do it day in, day out of as their profession, but also those that are doing it perhaps in a different capacity. So we want to bring all of those people together, and we think that every piece is essential and valuable when we're undertaking these joint efforts. We deliver our mission via 3 channels. We have a digital channel, which includes our extensive website, which has got lots of professional development and support, a knowledge share, event calendars, the webinars that you'll find all of those there that are upcoming, and recordings of previous ones. Lots of resources, as well as online networking opportunities between our ISSUP members, and information on what ISSUP is doing itself and what our national chapters are all doing. Our events, so we hold regular events. We used to have the large scale conferences when we were doing it in person, and we plan to go back to that as well. But we also have a schedule of regular weekly online events for covering a range of topics provided by a range of speakers. So that's always there and continually being updated. And the third approach is our national chapters, which really allow us to work with the key organisations at the country level to connect with members within their own language, culture and reference points. And it builds an exchange between that country and the rest of the world. We currently have 24 national chapters with the launch today of ISSUP Greece, which I am really delighted to be able to be here for this event. Greece is really a huge asset to ISSUP's work. As I said, it's, you know, it takes us up another step in order to achieve our mission. We're really looking forward to learning from all of you, the ISSUP members in the country, as well as the staff and the professionals that are involved with ISSUP Greece. And we are very happy that you're joining to build relationships with us, ISSUP, and the other ISSUP members. I want to very quickly say thank you ever so much to the ISSUP Greece team, particularly Natalia, Stelios, and the President Phaidon, of course, for all your work and enduring enthusiasm in taking ISSUP's mission forward in Greece. I hope that all of our listeners now are joining ISSUP Greece, and I may admit that I had a little look at the registrations queue whilst Phaidon, you were doing your introduction, and within the first 5 minutes we'd had 4 people already apply for their ISSUP Greece membership. So if you would all like to carry on doing that, and we wish you all the best and really welcome ISSUP Greece to the ISSUP family.
Thank you, Joanna. We know also well that in the future, this will be a very fruitful and mutually productive cooperation, and we may count on you for being on our side from the onset until the whole project flies. And we know against the pandemic backdrop is by far not easy. 420 new registrations. I just heard it shortly before we started, not just 420. And just as Joanna said, there are members, and I love to hear that. What a nice surprise. And given the circumstances, this is a major surprise and a very pleasant one, because it is a new dean of the Faculty of Psychiatry in California, San Diego. Many of you know that San Diego, the University of California at San Diego, has been having a cooperation with CAFE for many, many years under the umbrella of a program we dub San Diego. Quickly, correct me, Anna, if I'm wrong, but we're about to start the 21st cycle. Indeed, says Anna Simbukli. And there are so many applications for participation in the 23rd cycle. And are we grateful for these? Both as a member of CAFEA and as a professional, I may only hail the University of California's contribution to this effort. So we have a new dean. First surprise. Surprise number 2. The name is Zafiris Daskalakis, and he comes from Thessaloniki. He was born in Toumba, a neighborhood of Thessaloniki. I cannot see him on the screen. His camera is off, but he just finished his lecture and he will be taking the floor.
Dr. Daskalakis, are you there?
I am. Can you hear me?
Oh, great. Welcome. You're our surprise guest, as you can guess.
It's my
Okay,
pleasure.
so thank you so much. The floor is yours. Please go ahead.
Thank you. As you all know, this is my first time joining this group. It's actually my first time making some introductory remarks to any group as chair of the Psychiatry for an International meeting. So it's my absolute pleasure. I actually, as was just mentioned, my Greek is I consider myself reasonably fluent in Greek. My parents are both from Greece. They immigrated to Canada. So I was born and raised in Toronto, which had a very alive, healthy, and vibrant Greek community. I grew up in the Greek community in Toronto. My dad was actually orphaned, and he was orphaned at a young age, and was in Papatio in Toumba, and I drove through there, and I went to the Papatio, and I met with a number of people there. It's an incredible organization, just like this organization. So it's my pleasure to be here. I started as chair of the Department of Psychiatry in August of 2020. a very unique experience to start as chair of a major academic department in the US at the same time that COVID hit. And so we've all gone through a considerable transformation in our lives in the last year, and I've certainly seen a huge change in my life, both because of COVID, but also because of this new role. And it's an exciting new role. I've met extraordinary people, and San Diego is one of the beautiful places on earth. And if you haven't been to San Diego, I will tell you, it reminds me very much of Greece, which was a pleasant surprise when I arrived here. Some of the hills and the mountains look very much like the hills and the mountains outside of Athens. And so it is actually my pleasure. And when I first arrived here, I met Igor, and Igor told me, Igor Koutsounak, about the incredible partnerships with Greece. And I was delighted to hear that. I visit almost every year and look forward to visiting in the future. And congratulations on the wonderful work that you do. I actually have to step away. I have to rejoin a meeting, but thank you for honoring me and allowing me to make some remarks. And I look forward to future collaborations together.
Ευχαριστούμε πάρα πολύ. Παρεπιπτόντως, και εγώ στο Τορόντο ζούσα, Pape and Danforth, on Pape and Danforth. Είναι το κέντρο της ελληνικής κοινότητας.
Yeah, no, I grew up.
I used to live on Pape and Danforth.
1325 Pape Avenue, so I was not far.
Just around the corner.
Yeah.
Just above the Acropolis Bougatsa place. That's where I used to live.
I know it well.
Thank you very much. We rejoice in the fact that you are with us, and we're very proud to have you where you are. You represent Greece gloriously. Thank you very much. Thank you very much. Prior to going on, I'd like to change hats. Otherwise, I'll be having a problem with my colleagues. Now I am a chairperson of the CFDC. My colleagues at the board asked me to convey their best wishes and express their joy and appreciation. Next hat, vice chairperson of the International Association, Dr. Sussman, asked me to convey her best wishes for the launching of this event. That was the end of the succession of hats. Now, there are 7 short video presentations by as many as 7 different reps and chairpersons of other chapters, national chapters, in the order of airing: the Philippines, Kenya, Brazil, Italy, and there we have a surprise, we'll see what I mean, then India, Pakistan, and Nigeria. And I believe that very intensely and tangibly shall we all see how important it is for us to be part of an international network, an international module, hand in hand with people who are so directly involved in what we all do. Olivia, we may now start airing the videos one after the other. Olivia, back to you.
Teresita Castillo, Chair and President of ISSUP.
From the Philippines, I am Teresita Castillo, Chair and President of ISSUP Philippines. And on behalf of our Board of Trustees, officers, and members of ISSUP Philippine Chapter, we extend our heartfelt felicitations and congratulations to ISSUP Greece. We wish you all the best as you begin your wonderful and exciting journey to unite, connect, and share to ISSUP's growing network of professionals in the field of SUD prevention, treatment, and recovery. We hope to be able to maybe collaborate with you in any one of our future projects. Again, our congratulations, and we wish you all the best. Mabuhay!
My dear brothers and sisters from Greece, on behalf of the International Society for Substance Use Professionals, Kenyan chapter, I would like to congratulate you on the launch of the Greek chapter of ISSUP. You join a network of global practitioners in the area of drug demand reduction and substance use management. We hope to work with you in the training, in the professionalizing, and in the capacity building of the global drug demand workforce worldwide. ISSUP Kenya warmly welcomes you. Karibu, asante.
Olá, queridos amigos do Capítulo Nacional da Grécia. É com muita alegria que dou os parabéns a todos que contribuíram para a formação deste capítulo. Em especial ao meu querido amigo Fedon, que tem uma história de vida linda, ajudando muito as pessoas com o uso abusivo de substâncias. Ter um capítulo nacional do ISSUP em um país é muito importante. Aqui no Brasil, estamos há quase 3 anos com o nosso capítulo nacional e a contribuição de maior relevância foi a conscientização da importância de se fazer um trabalho de capacitação baseado em evidências científicas. O Brasil tem uma rede muito grande de voluntários e profissionais que trabalham no setor e que entendem o quanto essas capacitações são fundamentais. Além disso, no último ano temos focado muito em prevenção. Essa palavra tem sido dita no mundo todo, também por causa da pandemia do Covid. Mas o uso abusivo de substâncias é uma grande pandemia que precisamos combater. O melhor caminho é a unidade, a união de toda a sociedade civil de um país buscando intensificar a prevenção e com isso ajudando a proteger nossas crianças e jovens. Essa proteção garante um futuro melhor a estes jovens e, em consequência, ao país. O Capítulo Nacional do Brasil se coloca à disposição para ajudar o Capítulo Nacional da Grécia no que for preciso. Contem sempre conosco e Deus abençoe a todos vocês. Muito obrigado.
Καλημέρα στο ISSUP Ελλάδα από ISSUP Italia. My name is Pina and I'm the Executive Director of our national chapter. And it is a privilege and an honor to bring you greetings from ISSUP Italy and sincere congratulations for this important achievement. You are our neighbors, our friends, our relations, as many of us in many parts of Italy, especially in the south, have Greek ancestors. And we are proud of it. I'm one of them. Our Greek forefathers left us with a spectacular cultural heritage in art, cooking, science, literature, as well as children, our forefathers and our foremothers. As we wish you every success in this endeavor, we hope for a close collaboration between our two national chapters, whether on drug demand reduction, prevention, treatment, recovery, and social reintegration of people affected by drug addiction, as well as specific interest for families that are usually left out, they are usually left behind. I take this opportunity to announce that the launch of a national chapter will take place on the 25th of June, and you are all invited to take part. It will be virtual as well. I conclude by saying we will see you very soon, and sinkaritiriaki kalitaki.
Greetings from ISSUP India. I am Sadibhan Singh, and on behalf of the entire ISSUP India family and Dr. Rajesh, allow me to congratulate ISSUP Greece, Mr. Fedon, and ISSUP Global for inaugurating yet another chapter. We all are learning and sharing our experiences of what we learned together, and hopefully this partnership that we all share together just evolves, and hopefully we'll be able to serve more people and work with more people. Mr. Fedor, you were here when we were inaugurating our chapter. Because of pandemic and everything else, we couldn't be there. But you know, we will not let that determine our partnership. Congratulations yet again, and all the best wishes from ISSUP India.
Hello everyone, my name is Saima Asghar. I am Director ISSUP Pakistan Chapter, and on behalf of ISSUP Pakistan Chapter, I want to congratulate you all on this auspicious occasion to launch ISSUP Greece and warmly welcome you all to become a part of ISSUP Global's National Chapter's family. We believe that being part of this wonderful network, ISSUP opens up an infinite possibilities of opportunities to access information, training, and contact with our colleagues and professionals around the globe. We as National Chapter ISSUP Pakistan want to assure our support and looking forward to work with you, and together we can carry on the mission of ISSUP Globals in our respective countries to promote evidence-based practices in substance use prevention, treatment and recovery field. We are also very much thankful to all ISSUP Global's team for always having their support to take new initiatives to achieve our goals and to improve our work as national chapter. Once again, I want to extend my warmest welcome and best wishes for ISSUP Greece from Pakistan. Thank you. Good luck.
Hello, this is Martin Agoje, the National President of ISSUP Nigerian Chapter. This is to congratulate ISSUP Greece on the launch of ISSUP Greece National Chapter today, and to welcome you to the family of ISSUP National Chapters. So on behalf of members of ISSUP Nigerian Chapter, we say congratulations and welcome on board. We look forward to a healthy working relationship in the years ahead. Once again, congratulations and welcome on board.
Thank you very much, all colleagues, for having intervened. Am I being heard? Mr. Kaltarakis wants to know. Yes, fine. Very, very well. Thank you. Very interesting and very inspiring videos. You know, it seems that Greeks are everywhere. Well, here we are reaching the training part of our event. This is when the webinar officially starts. In a way, it has been modulated in two parts. At the end of all four presentations, hopefully there will be some time left for Q&A. Questions you may put through, of course, over your chat, and Nahalia Zahadzi and Vicky Papadimitriou will be channeling them to the speakers concerned. So the webinar has been moduled in two parts. First come two presentations on prevention, and the latter part will be dealing with training in the domain of addictions and therapy, treatment. Now, let us start with Giovanna Cabello. Giovanna Campello is head of the Department of Prevention, Treatment and reinstatement of the UN Bureau on Drugs and Crime. But besides that, her role is very critically in other fields. Besides UN, she is amongst the most respected specialists in the field of prevention. She's very fond of this field. She has been a reactionary of sorts. She, together with others, has been behind the development of standards that the UNDC has come up with. She has also been behind the Listen First campaign, so it is a pleasure and an honor for us, Giovanna, to have you with us.
Thank you so much. We're looking forward to hear from you once again. Giovanna, please, the floor is yours.
Thank you so much. Give me just 1 second that I have my I hear myself in the channel, so I want to stop that, or maybe I take this one off. Yeah. There you go. And you should be seeing my screen very soon. Got it? Perfect. So yes, let me start, and thank you very, very much for the kind invitation and the honor of having me. Good morning and good evening, particularly to the distinguished delegates of the government of Greece and of the many institutions involved in prevention and treatment that have been speaking so far and that are here with us today. Thank you so much for having me, and it has been a great pleasure to hear the friends from ISSUP family from all around the world. Really, really nice surprise. And so as Fedon was mentioning, I've been asked to present to you the international standards, and before I start and before maybe I ask you to stop for a moment to register yourself in ISSUP and go to this website on either on your computer or maybe on your phone, slido.com, because there you can input this number that you see here on the left, hashtag L392, and here you can vote and tell me a little bit what is your level of engagement with the standards so far. Maybe this is the first time you hear about the standards and you choose number 2, or you have heard about the standards and you choose number 1. You've heard about them, you choose number 2, or you have listened to a presentation on the standards and you choose number 3. And there are various choices until 7, where you think you know the standards by heart and you can take my place and give this presentation. I see finally somebody starting to vote. Please don't be shy. Nobody can see what you are voting. It's really just for people to participate a little bit. And since we have been listening to great and inspiring speeches, but it's also good to, to do something and active also while listening. And I'm just waiting a little bit, only 9 people, and I can see there are at least 227 people participating. So I'm waiting for a few more moments to see what people feel or what people know about the standards. And I can see that at least around half of the people is the first time that you hear about the standards, and welcome. I'm really delighted to present to you, and I hope that also for the others that maybe have heard me before or have actually used the standards, there will be something interesting to learn today. So thank you for those voting, and don't worry if you have not managed to vote this time, because there will be other opportunities during the presentation. Let me tell you a tiny bit about why we started to develop the standards. And this is a true story. And Igor, I don't remember if you were with us that time when this happened. And I was in the big room of the Commission of Narcotic Drugs, our governing body, with delegates from all over the world. And one delegate raised his hand and he said, "Oh, that's really nice and interesting what you're talking about prevention, and that prevention works. But prevention doesn't really work, does it?" And I had, this is a delegate from a member state. I cannot, be very emotional. So I had to stay very calm and explain that no, there is a lot of science that shows that prevention can be very, very effective. But that was also the time when I thought I really need to summarize the science and really show that there are strategies that are effective in preventing drug use and other risky behaviors, and that there is a science behind it. And this is how the standards were born. They are a summary of the science about what works and what does not work in prevention. We published a first edition in 2013, but today I'm presenting to you the second version that we published together with the World Health Organization in 2018. And we were not alone. We had at least more than 100 experts from 47 countries that were helping us. And I can see, you see in the map that Greece is colored. So I know that there was somebody from Greece as well, but also from all over the world, as you can see. And let me just reassure you a little bit. When I will tell you many times during these presentations that certain strategies have been found to be effective in preventing drug use and risky behaviors. And when I say that, what I mean is that during the development of the standards, I have found studies like this that allow me to make this statement. And this is a study of a prevention program that happens with children, and that, as you can see, follow the children until they were 21 years of age. And at that time, the group that did the intervention, that is in blue, reported less marijuana use in the past month, less teenage pregnancy, and reported more enrollment in college and university than the group that had not done the program. So when I say that a strategy has been found to be effective in the standards, these are the kind of studies that back this sentence up. And these are the real studies that show whether or not, as a result of a strategy, we can see a lower level of drug use, a lower level of risky behaviors. So really very looking at the real effectiveness of strategies. And what did we find out? Well, first of all, and this I will talk a little bit more in depth, we found out that, as you can see on this table, this is the table that summarizes all of the interventions that have been found to be effective in preventing drug use and other risky behaviors in the standards. And you can see that there are many strategies that have been found to be effective. And what we have found is also that these strategies do not only prevent drug use, but prevent many other risky behaviors. If you do evidence-based prevention, you will have less mental health problems, less risky sexual behaviors, better school performance, less violent behavior and delinquency, and of course also less substance use. So what we are talking about is that evidence-based prevention really supports the healthy and safe development of children and the well-being of youth and adults. It's really a holistic and people-centered approach centered on their health and well-being. And also we have found out that evidence-based prevention is cost-effective. And this is a very old, very conservative calculation of how much investing in prevention can save in terms of future health and social costs in the long run, 1 to 10, at least, I would add. So how does evidence-based prevention look like? And here I would like you to take again your phones and maybe vote and and respond to this very simple question. At what age can prevention of drug use and other risky behaviors start? And I've given you quite a range: before birth, 0 to 5, 6 to 10, 11 to 14, etc. Come on, vote. Woo! Somebody already saying before birth. 11 to 24. Go, 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 go. Vote, 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 vote. Yes, more votes than last time. Keeping them coming. Keep them coming. Okay, very good, very good. We have quite a split, like around 1/3 saying before birth during pregnancy, and then quite a bit of people, 1/4 saying 6 to 10, 11 to 14, Very, very good. In a recent presentation that I did, everybody was saying before birth, and I thought, like, are you really sure? When does prevention really start in your country? Because in many, many countries, a prevention really starts in adolescence, and not even 11 to 14 years of age, more 15 or so. But thank you for participating. And indeed, I have organized this part of the presentation in a few messages. And the first message is that really evidence-based prevention starts early. And the earlier, and even if I want to dramatize a little bit, the earlier, the better. And there are in the standards many interventions that you can do even before birth, indeed during pregnancy and in very early childhood. So for example, intervention with pregnant women or prenatal visits that starts before pregnancy and then follow the child, the very early child, or early childhood education, which is 2 to 5 years of age, or very good interventions for children of primary school age, classroom environment, personal and social skills, mental health services, keeping children in schools. And you remember this graph that I showed you before? This is in fact from a early childhood education intervention that happens when the children are 2 to 5 years of age. And as I mentioned, you can see the amazing results that could be documented at age 21 of these children, really having supported their healthy and safe development. Right on. Let's now move to a second message. And when you think about the content of prevention strategy, what is the most important that comes to your mind? Now, unfortunately, I have to ask you to write in English if you can, because unfortunately, I don't read Greece. I did study ancient Greek when I was in high school, but I am afraid it might not help me so much, having read your great poet Homer, to be able to decipher what you think is the best content for prevention strategy. But here I have courageous people. Thank you for participating, even if it's not your mother tongue. Building community, education coming out very, very strong. Yes, but also loads of skills and family. Very good. Life meaning. Thank you. Education still very, very, very prominent. Family education, information, personal and social skill, art, parents, resiliency. Thank you. Thank you so much for participating. And yes, family education, family going up, becoming bigger. And a lot of social and a lot of around skills and education, which is really, really great. Thank you. Thank you so much for participating. And I think that you are spot on, because I think that, let me see how we unmove here. Our second message is a focus on development and not only on information. Now, of course, don't get me wrong, information is very, very important. Perception of risk is key. And I'm sure you know this very famous graph showing how as perception of risk in the case of in this case of the use of marijuana, as perception of risk went down, use went up, and vice versa. So if that information that is accurate and scientific about the danger of using drugs is important, but it's not the only factor that is at play. There is a lot of different risk and protective factors that are mentioned on the left that we can influence, and to really ensure that the development of children is healthy and safe. And I want to give you an example of a program, of a kind of program that I think is very, very important. You mentioned families as well. I really think that families is one of the key pillars of prevention. And parenting programs do not really speak about the dangers of drugs. Parenting programs really work with parents so that they are better at being parents, they are more relaxed, more positive, and that bond between the children and the parents, which is the most important protective factor in the healthy and safe development of children, stays strong. And of course, also that parents are able to monitor and discipline their children in a positive way. And these kind of programs have been found to be very effective in preventing drug use and risky behaviors. And not only for the good families, right? The families that don't need them. We have been working with these programs in very violent communities, and we have seen improvement in the life of the children. We have been working with these programs in very poor communities, and there has been involvement. More recently, improvement, sorry, not involvement. More recently, we have been working with displaced population, Afghani refugees in Afghanistan, Afghani refugees in Serbia. And again, we have seen improvement in the mental health of the children and in the functioning of the families. We know that from the limited evidence that we have, that family-based prevention is the kind of prevention that more consistently provides good outcomes for both boys and girls. And again, we have been able to confirm this in our work with displaced population, where we have seen improvements for both girls and boys. And finally, one of the most important points that comes from the research of the WHO, of the World Health Organization, family programs have been found to be effective in preventing youth violence and in preventing child maltreatment. And this has become extremely relevant in the context of the pandemic, where we have seen incredibly increasing rates of domestic violence. And we have been creating all sorts of resources, including the Listen First campaign that Fedon very kindly mentioned introducing me, to support parents in dealing with the stresses of the pandemic in a way that increases the resilience of the family and of the children, and that is not disruptive. If I can try to go back, for us, these kind of programs are so important that we have created our own programs. They are in the public domain. They have been created to be easy and cheap to deliver. We have programs for everybody and also for very difficult situations. We hope that you are inspired to start this or to expand this line of work. And of course, as I was mentioning, okay, the earlier the better. We need to focus on development of children and youth, but really it's never too late, right? And in the standards, we have found that there is a lot of strategies that have been found to be effective in preventing drug use, also in adolescence and in adulthood. So of course you have preventive education. You had mentioned education so strong, which is based on skills, of course, but a lot of environmental work in schools, alcohol and tobacco policies, in the workplace, in entertainment venues, and of course working with the health sector in screening and brief interventions. These are just the key examples. Another important message, and I am a bit cognizant of the time, is to use evidence-based programs. And here again, I have another small poll for you. What does evidence-based means for you? What is an evidence-based program? What makes it evidence-based instead of not? Can we see what does Greece thinks about this? Come on, don't be shy. Research supported, thank you. Science, yes. Yes, research, a lot of research here. Evaluation, thank you, derives from research. necessary, thank you, very important evaluated intervention. And needs assessment, very, very, very true, and long-term evaluation. Thank you. Thank you so much for participating. And indeed, also for me or for us, when we talk about evidence-based prevention, what we really mean is to use strategies, the effectiveness of which has been demonstrated through scientific research. And that sounds simple, but you would not believe how many times in how many countries I find that people are implementing prevention because of personal opinion, I think it's a good idea, or because participants are so happy and interested to participate, or because of tradition, moral values, visibility. These are all very important considerations, but at the root of evidence-based prevention, there needs to be a strategy, the effectiveness of which has been demonstrated through scientific research. And this very often means that you will need to take maybe a program that has been evaluated in another country. And maybe this is not so much of a problem in Greece. I heard how there is a lot of innovation going in the country that could be exported, which is absolutely great. But let's say that you have developed an evidence-based program and another country wants to use it. And it is completely possible and it can be effective. The key is that you need to be very careful in your adaptation. Local adaptation is necessary, but it should be very careful. It's like when you buy a dress, right? You don't take the dress and start cutting it and changing it already. First, you try it, right? You try it as it is, and then you see whether it fits. And then you maybe start thinking about getting another dress or changing it. And local adaptation is the same. I seem to have lost a tiny bit, a few of these slides, but maybe not. And just to say that we have been doing this with family-based programs and school-based programs everywhere in the world, and it does work. These are two programs, and I'm sure you know Unplugged as well, because it has been used in Greece as well, that we use all around the world. And by following this process of local adaptations and by doing evaluation, as you were mentioning, we have been able to show real prevention results. So it is possible. If you want to go down this route, please get in contact with us. We are very happy to share our experiences with you. But maybe you cannot access an evidence-based program, and it can happen. So one of the things that you can use the standards for is to look in the standards and see what works and what does not work. So for each of the interventions that I was mentioning to you before, the standards give you a list of characteristics that have been found to be linked to effectiveness or to not effectiveness. So a list of characteristics that work or do not work. And for example, I don't want to go into the details because I'm cognizant of the time, but for example, in preventive education, we know from science what works in terms of content, a lot of a focus on skills, as you were mentioning. And we know what works in terms of delivery, a lot of interactive methodologies and a structure. And we know what does not work. So what you can do is, if you're doing a preventive education program and it's not an evidence-based program, you can compare your existing program to the standards and see, oh, I am on the right track. Oh, no, maybe, but there is something that I can do to improve, and really move towards that more evidence-informed kind of prevention, and possibly sooner or later you will do a good evaluation and really become evidence-based.
A final message is, of course, the fact that you will need to try and move away from having one single program to having a system of programs and interventions in different settings. And I want to show you just this last graph on the result of this particular program on the prevalence on non-medical use of prescription opioids that followed kids from 12 to 18. And you can see that compared to the control, which is in gray, if you deliver only a school program, you already prevented quite a bit of prevalence. But if you added the parenting program as well, your effectiveness was more strong. So it really pays off to start building systems of prevention so that we really manage to support the healthy and safe development of children and the well-being of adults throughout their lifespan. And here I conclude. I hope I have inspired you at least a little bit to pick up those standards, maybe to get in contact with me, or maybe to get in contact with your fellow members of ISSUP, either in Greece or all around the world, to exchange those experiences and improve and expand prevention. Thank you so much. And now you go back and get yourself, become a member of ISSUP Greece. Thank you.
Thank you, dearly, Giovanna. Within a few minutes only, Giovanna was able to provide us a very comprehensive outlook of the substance of all standards about prevention. That was within only a few minutes. Thank you very much for being succinct and so efficient. In the end, some questions will be put through. Next, to take the floor, well, how can I introduce this person? He is the head of DCA, the European Observatory on Drugs, based in Lisbon. It is my personal opinion, without downplaying the work of all of his predecessors, but as of late, while he's at the wheel of this organization, the observatory, to put it simply, is smashing. It is smashing indeed. And me coming from the field of therapy, the treatment guide he has come up with is something unique, something this is our own Alexis. He's Alexis Ghostil. Alexis Ghostil is the next speaker to introduce the Platon program. Alexis, without further ado, you have the floor, and thank you very much for being with us.
Can
you hear me? Yes. Well, first of all, I would like to thank you all for the invitation, as well as for the honor paid upon me to let me intervene as of this launching event for the Greek chapter of ISSUP. It is also a pleasure for me to be able to see many of my dear friends in Greece. You know that you're all very close to my heart. You're my family. Unfortunately, I can only see you on the screen for the moment. This is the most anti-Greek thing I can think of, because we know we are emotional people, we are full of pathos, and we want to touch each other. Now, all we have is a screen to touch upon, not exactly the same thing. The only good thing I can think of is that since we have Zoom and Interactio, never mind the subway system in Thessaloniki, Fedon, the only thing I'm afraid of is that maybe now they abandoned the subway project, but then again, no more local humor, please. It is too localized. Let me switch to English, because indeed we have our foreign guests that deserve to follow this event directly. It would not be fair to speak in Greek.
I want first to congratulate all the colleagues from ISSUP. Of course, you know, EMCDDA has a very close cooperation with ISSUP. I'm also very happy to see some of my ISSUP friends to be there today. when I was listening to the ISSUP representatives, I was thinking, well, usually we meet in this time of the year in Vienna, in the corridors or in some side events. To this year, unfortunately, not in the corridors, not in the streets, not in Vienna. At least we meet here. And I'm also, I want to congratulate UNODC and Giovanna. And to be honest, I'm very happy that I chose a slightly different topic, because the presentation from Giovanna was excellent. And I think it would have been a bad idea to try to repeat with less talent what she has been presenting. So what I'm trying to do now with you is to share with you why we believe that's extremely important to develop capacity building on prevention in the EU, and what at EMCDDA we try to do to support the professionals and the member states. I want to thank, of course, FEDON and all the Greek colleagues who organized and created the chapter. I think you do a fantastic job, and I want to thank FEDON for the compliment about the added value of the MCDDA. The truth is, we have a 2025 strategy. The top level priority for us in the area of public health has three elements. The first is to support the implementation of prevention in the member states. The second is to increase the access of people who are using drugs to testing and treatment for Hep C and HIV. And the third is to make a significant contribution to reduce the drug-related death. And of course, I want to thank Christos Kouintsidis, and I want to give full support to what he said. And I must say that when we speak about Europe, but also about Greece, it's really important to professionalize prevention every time more. All over Europe, we have only more or less 10% of people who are working in the area of prevention who followed any kind of capacity training, and most of them have received the training on the field when they were already working. So there is a huge need to help disseminate and to make the countries adopt the best practice. I fully agree with what was said by the previous speakers, and I can tell you that the main challenge for us, and my main objective, and certainly probably it comes also because I'm a clinical psychologist. I've been working on the field with people who are using drugs. I mean, for me to have any kind of nice database or nice manual, if the countries do not use them, it becomes completely useless, and we cannot afford that. So what are we doing for that? First, EMCDDA has prevention as one of the key priorities since we were established. The regulation was adopted in February '93, 18 years ago, and we started 28 years ago, sorry, and we started our activities 25 years ago. From the beginning, we started working on demand reduction, starting with prevention. In 2016, there was a recast of our regulation that paved the ground for us to develop and to build, to give a new impetus on our work on best practice with the creation of the best practice portal. We also have been tasked with the implementation of European Council conclusions on minimum quality standards. That is extremely important because for all the non-European Union colleagues, it's important for you to know that the competences of the EU on drugs and drugs policy are quite limited. And most of the competences are in the hands of the member states, especially for demand reduction, everything that is about implementation. And to have to manage, as we did successfully, to get one of the highest possible level of joint declaration for all the member states as part of the Council conclusions on minimum quality standards was very important. The MCDDA is responsible for part of the EU strategy for the implementation through the action plan, the key performance indicators, drugs agenda. the role that we play and that we want and should play even more in the future on the supporting the implementation of best practice in prevention was recognized and mentioned in the last findings in the findings of our last external evaluation. And we are playing an increasing role in the sustainability of the other funded projects. We celebrated, we have a special page on our website about what we have been achieving on prevention and the MCDD over the last 25 years. And just to say a few milestones in the journey, not only of EMCDDA, but of EMCDDA, European Union, and all experts inside the EU on prevention. We started in 2000 first to promote basic evaluation of programs. And we immediately started creating the EDRA database, which was the first attempt to collect evidence-based programs and programs that had benefited from an evaluation. Then we moved the following period in better describing and classifying prevention interventions, using, among other things, EDRA. And at that time, each national drug observatory working as part of the RATOX network of the MCDDA had one person working on the EDRA database and on prevention. And Greece already at that time was a pioneer with all the units, all the departments for prevention of OCANA that were spread all over the country. 2006, 2010, we started going further, building the knowledge base, the evidence base for prevention. In 2011, 2015, we started disseminating as we build the new portal, new resources to promote the evidence-based and prevention science. And until last year, taking more initiatives to take the evidence into the field of practice and decision making. Now we enter in the new phase, which is entering into digital dissemination, capacity building, and accreditation. There is a shift that was operated by the center to reflect or explain a bit what Fedon explained. At the start of my first mandate 5 years ago, my proposal and my commitment was to present a long-term strategy for the MCDDA. And some of the key highlights, key assets of the first ever long-term strategy for the agency was first, a new focus on support to policy makers and practitioners who have been defined as our primary clients, primary customers. A new emphasis from data collection or information or data provider to become more knowledge production and service provider. There was a new step forward, which was the involvement of stakeholders towards more co-production in the work of the agency. And this was first reflected in the drafting and the publishing of the EU response guide model to which Fedon was making a reference, because it is the first time that we have associated our stakeholders during the process of production of the European response guide, discussing with the stakeholders, including heads or professionals from the treatment area, from prevention, from harm reduction, including representatives from associations of people who are using drugs, to discuss with them the main findings and recommendations, and also what would be the best ways to convey those messages to the different target groups, starting with our key groups of customers, policymakers, and practitioners. I will not enter in the detail of the guide now. Just I would like to highlight that the strategic focus of our prevention activities has been, we changed the center of gravity, moving definitely toward an absolute priority to facilitate the implementation of evidence-based prevention. What is interesting is that 2 years ago, I was in Washington. We had a meeting with Nora Volkov from NIDA. We had also meetings with different colleagues. I have regular meeting with the Health Director, General Directorate of the European Commission, and we shared the same conclusion. The problem today is not so much a lack of evidence, is the fact that we lack enough people using, translating, adopting the evidence at field level. And I think it's important, and we also need to remind, it's not only about prevention, it's about considering also, and I really fully support what Christo said in his welcome speech, it is about considering everybody as human beings, as citizens, and recognizing the rights of each of them. And as I am following and working in Greece and with Greeks for more than 30 years, I think we still have progress to make. In some cases, it's still too much dogma, and we, all the professionals, and you all, I know you have a lot of problems. You need to face stigma for users, stigma for people who work with them, lack of respect, lack of support, even for the implementation of new treatment programs. And I would say that I can tell you that I take as an extremely interesting example the fact that despite the COVID pandemic, you managed to create a new shelter in Athens for homeless people who are using drugs. That's a fantastic achievement, and this is also a big step forward. So what we currently offer, we have a different set of tools, and we are going to present to develop more in the coming months and years. We have a comprehensive toolkit with evidence, examples, reports, guidelines, and some manuals that are resulting from both our own development activities and the partnerships with different EC and the projects. I will not enter in detail, but if you visit our website, if you have not yet done, you will see that we have the best practice portal with the evidence database. You have the Exchange Prevention Registry, that is an online registry of evidence-based prevention programs. We have a few manuals. The first one was the European Drug Prevention Quality Standards. We have also a database with evaluation tools and methodologies. When Giovanna was presenting the standards, I think it's important also to highlight that following the international development of the universal prevention curriculum, at European level, we have also developed the European adaptation of the universal curriculum. And those EU minimum standards, they have as one of these objectives to improve the workforce, considering that those developing prevention interventions have competencies and expertise on prevention, should have competencies and expertise on prevention principles, theories and practice, and are trained and specialized professionals. So the next step in working on that was supporting the translation of the international universal prevention curriculum into the European one. There is now a new project that is working on supporting the implementation that is already translated in 11 languages in 14 EU countries. I had the privilege 1 week or 2 weeks ago to participate in the last seminar and training seminar of the ISSUP project in Athens. And the ISSUP is the name of the project financed by the European Commission. And the ISSUP program now is giving us the opportunity to, in the short term, within 12 or 14 months, to go fully digital, providing for the first time in Europe, in the European Union, an online distance training program with the certification capacity for the training certificate and for the professionals. And what is extremely important for us, and that is also one of the key steps of the movements that we have initiated in the agency for many years already, it is the building and the development of a virtual community of practice. So that's a snapshot of the ISSUP learning platform that is under development and that is going to be transferred to the MCDDA at the end of the project this year. This is the concept around the virtual community of practice, which is to combine, to give the opportunity to professionals to exchange and participate in different thematic groups. to take the opportunity for some informal, to have new initiatives for informal learning, to build over time a repository and sharing of best practice, and also to have the opportunity to organize polls, either at the initiative of the MCDD or the members of the community, to understand better what are the new trends or what are the new challenges, what are the new difficulties. And then I'm very proud to present you Plateau as the platform project that will host all those elements starting from this year. Of course, the Greek friends of mine will notice with some humor that my colleagues at EMCDD have been very creative in finding for the name of the program such a famous Greek name as Plato. Someone told me that my colleagues were very lucky that it became only half Greek and not Chinese. It would probably have been more difficult to find a suitable name from the program. Still, I think it's a tribute to the cooperation and the community of thought that I share with all of you. What will the Plateau platform do? It will sustain and customize the ISSUP platform and the virtual community of practice. We are also ensuring the integration with two important technical cooperation projects, IPA, which is the technical cooperation with Southeastern European countries and with Turkey, that are the countries that are candidate and potential candidate to the EU. And we are working on launching a test edition of the ISSUP platform training for prevention professionals in all Southern Eastern European countries. And then as I see Igor and the other friends that are there, it's good to mention that EU for Drug Monitoring is the technical cooperation project we have with all the countries that are neighboring the EU, from all the southern and eastern Mediterranean to Belarus, Ukraine, Moldova, and then Georgia, Armenia, and Azerbaijan. And we are working already. We had a training winter course for professionals that was ending today, and we had already professionals from some of those countries that have been trained at the MCDDA. We are accelerating the exploration of accreditation options at two levels, either for the accreditation of the professionals who have been following the training, but also one of the priorities from the EMCDDA is also to further develop national certification programs in the member states that are interested and that realize they need to do. And I can tell you that since we have been accelerating the pace of the work in that area, we have already 4 countries that have made significant changes in their strategy and action plans. And we are exploring how to deepen the cooperation with the European Crime Prevention Network to include this dimension also in the program. So this was, in a few words, what we tried to achieve. And my last message, my conclusion is that learning from the lessons learned from COVID-19 pandemic that are not yet finished, is that what the new series of webinars, EMCDDA webinars we have created, and all the new online initiatives, including online focus groups and online transportings, I have 4 things I want, 4 points to share with you. First is we need more inclusive strategies and programs. So we will never manage to achieve anything sustainable if it is only about specific drug programs. We need an articulation, much broader articulation, with a more holistic and comprehensive approach. That's my second point. The 3 point that has been highlighted by all the professionals from treatment services, harm reduction services, association of people using drugs, told last year through the seminars and the surveys, is that it's extremely important to maintain community support and social services. In many countries, like Spain, for instance, or Italy, the testimony for the colleagues from the field is that if they found themselves really alone and abandoned, at least during the first phase of lockdown, there was a strong disruption of services. The staff from all the services were not protected. They did not have access to protective equipment. They were not considered as essential services. And this is why we have launched end of June a special campaign to raise the awareness of the member states. But also to finish, we need to learn also from the innovation and the many new initiatives that have been taken during COVID-19, because we are conscious, we are aware that the evidence, when we speak about scientific evidence and evidence-based work, means that what the first thing we learn from science is we need to recognize better what we don't know. And what is more or less certain or sure today may be different in 5 or 10 years' time. So we need to continue to change, to innovate, to learn the lessons from the practice, from the professionals. And therefore, I think that the creation of the ISSUP chapter in Greece is a very good initiative. We are definitely there to provide all the support that you may need, because we need to remind all the people who are against program for people who are using drugs, all the people who are against program of prevention, or who prefer to send the policeman with a dog in the schools. This is not prevention. And it is about our children, our citizens, and our children, the teenagers who may be using drugs. They are the citizens of tomorrow. They are the decision makers of tomorrow. So it's only together that we can build and ensure a better tomorrow for all of them, including for all of us. Thank you very much.
Thank you, Alexis, for this very well documented presentation. Wow, I would say. All you said is highly appreciated. It connects to what Giovanna said, and those who are in the domain of prevention, they should be celebrating. Thank you very much. Indeed, thank you very much. I only have 15 to 20 minutes, and I will have to leave you. So if there are any questions, this is the time to put them through. If you have any question, anything. Well, actually, we were thinking of waiting for the end, but if there is a question from Natalia, a question for Alexis, perhaps? Never mind. Up to now, I don't have any question. Nevertheless, I have many messages coming from colleagues, and that is why I'm reading into my screen all the time. All colleagues are enthusiastic about what they have been hearing and very happy to see so much focus has been placed on prevention. And so many things are being said and perspectives opening. Indeed, this is so important to see prevention being so prized. And since these are colleagues that have trained on ISSUP, Alexis, this is indeed a module we've been running together with colleagues here in Greece, with Julia. And we rejoice in the fact that all this has been connecting very well to what has been happening in Greece. Alexis, you are free to go. Thank you very much for being with us. Thank you.
Ευχαριστούμε.
Σας ευχαριστώ πάρα πολύ. Γεια σας. Bye bye, colleagues. Was a pleasure to meet you. Bobby, Igor, Joanna, Stelio, Julia, Natalia, and Giovanna, Christo. Looking forward to see you soon. Goodbye, guys.
Γεια σου, Αλέξη μου.
Bye, Alexis. Thank you very much once again. Changing the tune, says Fiden. Changing the tune. Therefore, let us go to the field of training. And, you know, all of the speakers are friends. I'm trying to be professional, but when I'm addressing friends, I forcibly become very personal. Igor Kuchenok has a footprint of his own, not just in America, but everywhere. In the Balkans, in Europe, everywhere. Back at the time of his mandate with the UN, he has been amongst those who contributed so much to the development of standards, and in so many other ways he has been instrumental. He is one of those persons that have been supporting so lively our efforts. Amongst other things, he taught in our modules at CAFEA together with the University of California. Igor, thank you once again for being with us. The floor is yours.
We cannot hear you.
Right, we can't hear you.
Do you hear now?
Yes, yes,
Okay,
thank you.
wonderful. Let me just share my screen. I'm trying to figure it out how to do that.
We can see your screen. You just need to put your PowerPoint on presentation mode.
Oh, here it is. Do you see it now?
We can see your desktop.
Do you see the presentation?
No, could you just click in sharing? Could you click the play button? You might have paused your screen sharing.
Hold on. Stop sharing screen. So what am I supposed to click now?
You can just press the play button, the show screen in your control panel.
Okay, now you see it?
Yeah, now we can see your PowerPoint. Perfect.
Well, good morning, everybody, and thank you all for inviting me, and thank you, Fedon. We are very old friends with Fedon, and thank you with many other friends that I see here. It is my pleasure and it's my privilege to address you, to congratulate the ISSUP Greek chapter. Since all the celebratory and ceremonial things are over, my presentation, well, actually, I will give you some bad news because somebody needs to get us all back to earth and see what are the challenges that we are facing all over the world. As a way of getting started, I would like to offer you a hypothetical. Imagine you are a prime minister of a country X, and you just got a reliable report that in your country, only 20% of patients with diabetes are getting treatment, any kind of treatment, meaning 80% are not treated at all. And among this 20% that are getting treatment, actually treatment starts after their kidneys have failed and the legs are amputated, meaning severe complications. What would you do? Well, I don't know what would you do. I know what I would do. I would do two things. First, I would fire the Minister of Health right away. And secondly, I would significantly and rapidly increase the training and education in early detection and early intervention in patients or potential patients with diabetes. Okay, does that make sense? I think it does. So get rid of the Minister of Health, who is apparently totally incompetent, and increase the intensity of education, particularly the education in the primary health settings as early as possible. Folks, unfortunately, this is what is happening in substance use disorder treatment globally, all over the world. We have a large population of people for whom the prevention is the only thing we need to do because they don't have any problems, 70 to 75%. We have approximately 20 to 25% of people who have some difficulties in their relationship with substances, although they will never come to see me, but most likely they will come into attention of primary healthcare settings. And we have 5 to 10% of people with already very severe substance use disorders. Folks, and this is what usually happens, and I really want to make sure that we understand how difficult and challenging and problematic this situation is all over the world. We completely ignore the first two populations that are very sizable. We wait until people develop serious substance use disorders. and then we offer some treatment to some of them, not all of them, and then for some reason we are terribly surprised the treatment is not as effective as it should be. It doesn't make any sense to me, folks. So if I'm a prime minister of a country X with that picture in addiction treatment, I would rapidly increase training and education in general health settings, in primary health settings, and particularly in pediatric settings. Because if you think about it, substance use disorders are disorders, these are chronic conditions with pediatric onset. The typical age of onset of the problem is 12 to 16, which is a pediatric age. So this is in fact a pediatric disorder that continues later in life. Many questions that many times I've heard this question: is treatment worth it? Does it make sense? Well, folks, these are the numbers from the US. I'm not sure if they will be accurate all over the world, but in the US, we have billions, $440 billion we are losing because of substance use and substance use disorders and related problems. And this amount is larger than the amount of the Iraq and Afghanistan wars combined. And if you look at the treatment versus no treatment, meaning cost ratio and cost benefit ratio, for every dollar we invest in good quality treatment, actually the savings are $6.5 to $7. Colleagues, even the greediest Wall Street banks would consider this a wonderful investment. And think about what is it that we are doing globally. And here is the bad news for you folks, at least the worrisome news for me, and I would like to share it. One of the problems, not the only one, but one of the significant problems that we need to address and need to start doing something about it, and this is what the ISSUP is actually could be very helpful, is the way we train our physicians, our medical professionals. Now I'm talking about medical schools and physicians, but it's actually, the picture is pretty much the same in nursing schools and similar medical schools. Here is what we learned recently from one of the largest surveys and studies on the physicians, primary health care doctors, and substance use disorders. More than half of the patients reported the physicians didn't even address their substance use. More than 40% of patients actually reported that their doctors actually missed the diagnosis of substance use disorders. And less than a quarter of the patients have been actually involved in the decision making to seek treatment for their substance use disorders. When the physicians have been asked, actually most of them, more than 80%, said that they're very comfortable diagnosing hypertension, diabetes, asthma, or similar chronic and relapsing conditions, but less than 20% of them said that they're confident and they really feel prepared to identify drug and alcohol problems. And let me tell you something else here. When I teach physicians, I train doctors, I train residents. When I talk to most of them, typically, this is not the fact that they're not addressing this issue is not the expression of their ignorance. They're not ignorant. Most of them, almost all of them, know that they need to ask questions and they need to do some screening and eventually assessment of the extent, the nature, and the severity of substance use. But a lot of them actually don't do that, not because they're ignorant, because they don't know what to do if the answer is a yes. Then what? Then what follows? And this is something that is not their fault. We are not doing a good job training our physicians. The typical reasons why we are having challenges training young physicians or medical students, meaning doctors in training, one of the biggest problems actually is the negative attitude. This is the stigma. The negative attitude toward patients with substance use disorders. By the way, you know that in the entire medical field, the mental health is one of the most stigmatized. And within the mental health, the most stigmatized patients are the patients with substance use disorders. So this stigma is actually not uncommon even in medically trained people, even in doctors. Also, we don't have a single standardized, maybe not single, but a standardized, adequate, and effective curriculum to train medical professionals. Another reason is that our medical students are typically exposed to patients with severe substance use disorders with significant complications. So they don't see patients who are at the beginning of the development of substance use disorders when the interventions could be the most effective. And what we also found from multiple studies addressing the issue of training, addiction medicine training in the medical schools, that actually relatively simple, brief curricula that are based not as much on knowledge building, but rather knowledge and skill building. That's what makes the difference. Actually could be very effective in training professionals, training medical practitioners, and reducing the amount of stigma. Also, the combined didactic and interactive exposure, interactive trainings, actually this is something that medical students really like. And unfortunately, this is something that we need to develop more of and make it more attractive to everybody and more experiential to everybody, particularly to the students who in a couple of years will become young physicians and residents. We also lack of, at many universities, not in my university, we are just lucky we have one of the best addiction science programs in the world, but in many universities around the world, we lack faculty with good grasp and good quality in addiction medicine, good training in addiction medicine, so they will have hard time training others. While, as I told you, the primary health settings and the primary care doctors and medical professionals are the ones that I would pay particular attention to in terms of the training, because these are the people, including pediatric care, and I already explained why. These are the people who are frontline practitioners, and they're likely to see patients with some difficulties with substances much before they will come to see me as a specialized addiction psychiatrist. In primary care settings, if we do it, and if you look at the studies, actually more than a quarter of the patients will be screened positive for some level of substance use disorders, and that would be exactly the time to intervene and prevent significant complications. And most people, most of the patients actually would be willing to discuss their substance use and the difficulties with substances if they've been asked. So if they're not asked, they won't tell. But if they're asked in a very professional way, and we can train physicians how to do that, most likely the patients will tell the truth. I talked about the typical barriers. I really don't need, we need to go back to that. But when we train physicians, when we train young doctors or medical students or medical professionals, let's make sure we are training them on the things that you several times, or we already spoke about, evidence-based practices. And I want to quote my dear friend Alexis Gusdeal, who said, yes, we have plenty of evidence. The problem is not the lack of evidence, but the proper implementation of practices that are based on science. And in this pyramid, you see the strength of different scientific methodologies, how reliable the findings are from the perspective of real evidence that you can implement in real practice. The more difficult, the more complex, and the more sophisticated the methodology is, the more reliable the findings are, but at the same time, they will make us feel less good. So in other words, those of you who are doing research, if you just finished your study and the findings made you feel good, think again, did you use a reliable methodology? I already addressed this issue, the rationale for training in the medical schools and for medical professionals. These are the populations that, if are addressed properly from the medical and social work and case management perspective, we will prevent these people, or at least many of them, from joining this 5 to 10% of population with severe substance use disorders, and their treatment effectiveness will be significantly greater. This is my email, and I really, again, I want to thank you for your attention. I'm willing to entertain any questions. And again, thank you Thank you. Thank you. Good luck to all of you and be safe. And by the way, I forgot to tell you that this issue is significantly more complicated right now with the COVID pandemic, when we do not even have a clear direction, clear relationship, and direct contact with the students, and we have to do it through Zoom. And that makes the whole picture even worse.
Thank you, Igor. That latter comment of yours is a very good cue for our next speaker, who, just like Igor Kuchenok, is combining certain very interesting traits. He is a member of the academia with considerable work and research, a great scholar, but for many years he has been a field worker. So I believe that his students are also lucky because they have in front of them a person who, besides being a product, pardon my populism, of an oxygenated form of scientific knowledge, this is a person that knows what addiction is about. He has come into contact with drug users, and this knowledge of his has been transmitted to his students. First of all, many happy returns of the day, Babis. Yesterday was your birthday, so happy birthday, and thank you very much for joining us. Thank you very much for being with us. It's a pleasure for us, and we are looking forward to your speech, which will be the closing intervention of this round of speeches that was so enriching. Thank you very much, says Dr. Poulopoulos. Let me upload my presentation. Can you see that? Is it okay? Yes, it is. Yes, it is. I can see that very well. Yes. Thank you very much, says Dr. Poulopoulos. It is something of a marathon. This event is so fast, but I'll try to be brief, allowing for some time for Q&A and some exchanges. You know that we are crossing a difficult period, a time where fear is prevalent about the propagation of this disease. And what with these restrictions all around us, we have the impact upon our lives on a day-to-day basis. More and more measures lead to more isolation, and all the situation, the fear of death, the fear of being close to others, the fear of contagion this virus really is overwhelming. I don't know what the thing is in other countries, but in Greece, most people become recipients of messages of fear. There is fear mongering all around us, and we hear about deaths occurring. The news are full of that dark situation. A series of measures implemented differently from one region to the next, and try to fathom what the impact might be on people's day-to-day lives. There are children becoming recipients of these messages, and since we're speaking about prevention, you see, apart from the fear that is being instilled into children, there's no way of controlling the impact the media will be having on all of us for the years to come as well. Also important is it to mention what the changes will be in the financial sector, likely to affect the day-to-day reality of most of our citizens here and elsewhere. This situation, the pandemic, led to the adoption of restrictive measures, different from one country to the next, of course. Production shrunk, access to the markets also shrunk, and many people are at the risk of poverty and facing the grim perspective of unemployment. This poverty and unemployment are bound to affect a great number of our fellow citizens, whereas some other workers, which eventually are not in a precarious situation as yet, have had to adjust to a different situation very rapidly. So the digitalization became all too rapid and implemented not just at the level of various business fields, but in everyday life. And then there are policies limiting exchanges, there are breaches of rights, and more often than not, pandemics have been used as an excuse to shrink freedoms, and there is an ongoing anxiety that even after the pandemic, this might stay on. So repression is being reinforced, and because fines are not enough to ensure implementation of measures, priorities change. The whole focus is placed upon COVID. Other things are being neglected. Education programs have changed, and training and education are carried out on the remote basis. So there are restrictive measures to the detriment of the many, whereas at the same time there is an isolation and inboxing for those who are in socially precarious situations, amongst which prison mates, penitentiary mates, people with chronic problems, people who live in shelters and immigrant camps, a limitation of circulation for the many, inboxing of the few who are considered to be as the dejects and the parasites by reference to social standards of our time. So there is a parallel exacerbation of social inequalities, and this does not affect everybody in the same way. It is different to live, to have to stay behind walls in a luxurious apartment than living within a small flat of 50 square meters, having to stand all kind of privations and also do some teleworking. This situation has led to a huge solitude. Isolation has been exacerbated. Loneliness has been exacerbated. Psychiatric problems for many have worsened. Domestic violence has been rampaging, and there are people, try to feed them, people of age, the elderly who also live now isolated, abandoned even. And what we would say is that is prevalent nowadays is the fear, continuous anxiety, and anger. We know all too well that in times of crisis, and more specifically, this is not something that only limits itself to finance. We're also suffering this kind of consequences when there is unemployment and an important shrinking of income, and that for an extended period of time, when there is an isolation, solitude, anxiety skyrockets, anger skyrockets, and many people experiencing frustration and depression find it even harder to cope with emotional problems. Psychosomatic problems occur, and some people may also find themselves exhausted. Therefore, the use of substances, the recourse to alcohol and other illegal or legal substances might be a way whereby people are trying to unblock themselves from a kind of situation like this. We know that in therapy, what we're trying to come up with is to limit unemployment, because therapy is not just abstention from drugs or alcohol. Many more things are ascribing the context of prevention and therapy. The reduction of demand is but a small part of it. It is about reducing domestic violence, for example, but it's now rampaging amongst users. Delinquency should be shrinking. Psychiatric problems and mental health problems should be tackled. I won't be going further into details, there is no time for that, but educational problems we have, and this is definitely critical and different from what the general population is facing. Residents, suicidal attitudes, bad alimentation, and mortality and morbidity, which goes up and doubles. So there is a situation where problems tend to exacerbate. There is an increase of intensity of these problems, as we saw happened as of the previous financial crisis. All these things worsen And all this comes in conflict with our objectives in therapy. So it's a given fact that under such grim circumstances, the use models will be exacerbating. If one fails to find substances outside, one is bound to either manufacture substances or get hold of other substances trying to make things better, to manage one's sense of solitude, boredom, and isolation. Therapy is therefore going down. There is no disposition for one to join a program, and access might also be difficult, either because of the difficulties agencies have to reach out or because of difficulties of access amongst users. Therefore, one might even say, what's the point of getting therapy? There is no solution anyway. Hence, the exacerbation of passivity, and there's a higher attractiveness of medicinal models. One might easily say, well, perhaps I should take recourse to substitutes or even other substances, even non prescribed ones, in order to tackle the situation. In reintegration, difficulties are also high. Difficulties really are becoming bigger and bigger. How to integrate the labor market? Under the current circumstances, there is an increased risk, not just for users, but also for the rest of citizens who have not in the past faced problems to lose their jobs. There is an incapacity of making good of this possibility for teleworking. People may feel disinclined to use their mobile phones for training, but they find it easier to use their mobile for entertainment. In the meantime, terms of access to the labor market are so worse. There's a difficulty for people to find shelters. There is also a difficulty for the younger people to leave their family home to live alone. The whining is impossible to obtain. Stereotypes vis-a-vis users and addiction are getting more rigid. And this is a fact during times of crisis, and stress-inducing factors might possibly lead some of us towards difficult paths. One might say, well, is there no solution to that? Let us see what some people have found useful, how people are likely to manage the fear of death. You know, what's prevalent for the last year is not just health, it is the fear for the loss of health and the fear of death. More often than not, in order for this stress to be somehow managed or reduced, some people are led to strange situations that are potentially more risky. One might say, I'm special, I'm not affected. One may say so or feel so. In so doing, one exposes oneself to such risks, and this is something addicted people are bound to do. If anything, to prove how special they are, they're trying, in a way, to control a situation by exposing themselves to risk. They're trying to interpret facts in a total different way, in their own special way. So eventually, this is the way things are. Well, this gives an illusion of controlling the situation. So as of a research conducted by Kethea some months ago, amongst users exposed, whereas one might expect certain people to say that they are afraid of death, that their fear of death has been intensified, half of them now find it difficult, even impossible, to get infected by COVID. 7 out of 10 even say, I don't believe COVID is about in our hangouts. Some others do not fear infection, and they have other fears having to do with the use, finding food, moving about, finding a shelter, accessing to clean water or health services. We therefore see that whereas people of this type are so closer to death, and COVID exacerbates that, they tend to live a risky life by exposing themselves to even higher risks. Let us therefore see within such context what it is that may be done. Let us see how we could. You see, what I'm really worried about all this time is what really happens, what it is we may convey, what kind of experiential knowledge may we disseminate by way of contacting people over the internet. And let us consider internet as a heterotype field. Back in 1967, heterotopias were mentioned as a field within a community between regularity and utopia, a kind of normality that is not really reverted. It is something of a utopia that may be next to us, but have a parallel universe nature. A drugs joint might also be heterotopical field. So there are new forms of sociality that go beyond the common context, and within such heterotopy. And by the way, the penitentiary is an heterotopia, just as a therapeutic community may be a heterotopia. I don't have time for that, but let me mention a heterotopia of the internet. And that, because right now as we stand, we are witnessing a kind of heterotopia. This very webinar is being carried out in a heterotopic way because we're together and then we're separate. Here we are being present within a field, and we are affected by the reality. And then some people may be at home or at the office. They may have their children around. They may also have other people in the next room. But this virtual reality comes to fuse into the real world. So there is a partial denatured reality as we see people from chest up or even not at all. And this is what the internet does, and that's a criticism against it with respect to therapy. Whether therapy could be carried out efficiently and efficaciously over the internet. Moreover, as you know, there is a kind of democratic neutrality or pseudo-neutrality over the internet because people believe that by communicating over the internet in such a way where free, it is an illusion of sorts. And there are specific examples. We have seen this happening in Greece over the last few months about what happened when some citizens reacted to some realities and Facebook automatically eliminated some entries. So this is not democratic, is it? More often than not, we have the feeling of being near and then we're not. We may be in somebody's home on the screen, but a simple click on the button can eject us. So this kind of relationships are ephemeral. This is a substitute of human relationships, and Christakis, little Christos may be watching something else. People see this as enforcement or as a weakening thing. Internet is a fictitious context. We are all professionals in prevention, and more often than not, we think how we could potentially implement prevention over the internet or even therapy. So what with these considerations about the difficulties, one might say that there are even more difficulties. Having said that, when it comes to therapy, and there may be many opposite opinions, there is a kind of dystopia in this internet. Internet is the same for all. there are some inequalities of sorts, and countries in Africa do not have the same kind of access to internet as countries in Europe or the northern European countries when compared to India. So younger people are bound to use internet more than people of more advanced age, than the financial status. We're not having all the same possibility of purchasing a computer, let alone acceding to one. And then how about the educational level? There has been research suggesting that those of a lower educational background have a more difficult time with internet and acceding to it than those who are of an elevated level. But things are changing so rapidly in the society, in training, education, in labor, teleworking, for example, e-governance, e-justice, e-health, energy, transportation, everything against a digital transformation background change. So there are people who will be isolated, and the addicted, the majority of those people will be finding themselves cut out. So besides therapy, there is something wider, something ampler in transiting to the digital era. Besides social exclusion, we will have a digital exclusion. It's a twin-fold exclusion. Therefore, we need to ponder and reflect with respect to therapy. When we discuss therapy, let us not fall into the trap of all this. Yes, we all agree that by way of physical presence, things are better because I see each other and there's a different atmosphere, there is this kind of relationship, and then there is all this discussion about how one behaves. Still, under no circumstances can we afford to compare the internet to physical presence. But internet should be utilized in combination with other means. So here we are faced with a dilemma: providing therapy, education, or even training because of the restrictions being in place, and they will be so for a while, over the internet. Shall we do that? Many people refuse to shift, and even therapy executives and prevention officials, they are reticent. Some people say this should be really shunned. Still, it is obvious that what we knew was the normal thing before the COVID will never happen again. Changes will be happening, and they have happened in the meantime. And let us see how we can make prevention and therapy more efficient by using what we have in hand. How to build a therapeutic relationship in a novel way through the internet. Therapeutic relationship is about creating a safe context within which to allow the expression of emotions likely to help towards improvement and change. Treating is about defending one's right to become free, as well as supporting one vis-a-vis internal and external demons. Over this period, these demons can be even more numerous. So, under this context of uncertainty, of instability, of disorganization, we need to have a concerted effort towards looking for more points of stability for one to express one's solitude, pain, sorrow, all kinds of emotions. For this to happen, by way of a link that allow people to express themselves. And this is what the therapeutic relationship is about. Any kind of relationship, not just treatment, not just for the addictions. What we need to do in our field of expertise is this. Most training is about understanding addiction, so a cognitive level, and the implementation of certain models and the readiness for one to implement a kind of therapy. So, those things that the professionals should learn, whether psychologists or MDs, come through evaluation, therapeutic planning, networking, also providing individual consulting, advising families and individuals, and to facilitate integration within an ethical and deontological context, and also fostering efficient interventions. All this is also possible over the internet. Another major issue, and this is yet another thing I'd like us to ponder about, is how to deal with the most difficult model of all, that of the therapeutic community. It's a model in itself that requires intensive care and lots of participation. The main features, as we all know, of a therapeutic community are a well-structured day program hosted based on a contract of principles and rules set up by the members, requiring respect, participation, action, mutual assistance, and self-assistance. A special strategy is implemented. Community meetings amongst members, then members are bound to become active by participating in individual missions or collective ones, thereby maturing, also taking part in initiatives, and peer groups. Peer groups meaning that members at the comparable level of therapy are bound to participate to such modules for them to be treated, and then taking part in social skill development groups towards integration, family sessions, consulting session, individual ones. People are bound to attend seminars about topical content, and also participation in entertainment and other activities. And there are programs for physical fitness. To cut a long story short, all this may happen over the internet. There could be a kind of e-therapeutic community that will not substitute the physical presence of a community, but even past COVID, this might give the possibility to people who are unable to attend physically a session because of a remoteness. Those people may just as well benefit from a community that, in so developing, definitely will be helping these people to develop. And the most strong communities are those of hackers. Interestingly, hackers are implementing these principles of self-assistance, mutual support. So we may become inspired by them. Principles, values, methods, and tools of this kind may be also transmitted over the internet. I would like you to ponder on that, because you as professionals of the field might benefit from this technology. This might provide the possibility to have sessions, even to small groups or bigger groups, formations that could benefit from all this at a lower cost and with direct effectiveness, giving possibilities to many. The way whereby this can happen should be by the action research model. Access to information and activity should go through the projection of this kind of module, collecting data, and reconsider ways to implement it. The action model, the action research model, is a model which past planning and implementation could also lead to convergent cycles. And by the way, this reminds me of Kethea, where this model has been implemented when it comes to things we didn't know of in the past. In prison programs, as to which our organizations had no experience, and at the university, trying to transmit this model of research action plan, also interesting. Giving you an example, during the crisis, back in March 2020, students discovered that some vulnerable social groups were found in dire straits. Therefore, they created a page called So COVID-19, a social microscope, the social microscope of COVID-19, trying to fathom what the social impact of COVID-19 is, and thereby they gave guidelines, participated in webinars, also hosted radio programs. They also run publications in newspapers, thereby connecting the university to the society. Another group of students try to make the connection between what happens in life to a series of self-help groups, a project under the title of Zoe. Zoe, life is. Life is about losses and about discoveries. That's what we are experiencing. It is caring for oneself and for others. These are relationships and emotions, experiences, and experiments. It's about differences and equality and addictions, any kinds of addictions, and also about freedom. Hopefully, this is a good opportunity to all of us for this time to make of us a better person. Thank you very much for bearing with me. Bobby, it is us who are thanking you. I took it for granted that everybody knows you and failed to say that Babis Poulopoulos is the president of the Faculty of Social Work of the University of Democracy in Thrace and ex-director of Kithea. This ETC thing is something we have discussed already. This is something quite challenging and very attractive. Perhaps we should consider this as a European Confederation of Therapeutic Communities. Thank you very much, Babis. It is 10 to 9, and indeed it's a marathon of sorts. We have 10 minutes for Q&A, if there are any, or any comments by any speaker, not just Igor, Babis, and Giovanna, who I believe are already still with us. Joanna and Bill and anyone wishing to take the floor briefly, they may do so. Natalia, are there any requests for the floor? Fine, go ahead.
Προχώρα.
From ages ago, there is one of the people that are watching this that is asking that are the standards adapted to the COVID crisis situation framework? Are there any adjustment proposition regarding to our work in the primary prevention field? Did you hear me?
I heard the last part, but the beginning not.
I think that, well, the question is something that we have talked about. I think it may be from a colleague that are the standards, the universal standards of prevention, can they be adapted to the COVID crisis? And what is your proposition of an adjustment of the criteria regarding our work in the prevention field?
Thank you. So the standards are a summary of science, and the summary of science happened before the pandemic. So, and there are anyway gaps in the science, and certainly nobody was prepared, and certainly not the field of prevention at that point was prepared for what has happened during the pandemic. What we have observed in general is that, as I was mentioning, we have been starting to receive really serious report of increases in domestic violence, violence within the family, of course, also gender-based violence, but also violence against the children. And we have seen reports like the one from Save the Children that shows how this is particularly the case where there is higher economic insecurity. And we have seen how many families have been, of course, hit by economic disaster. Let's call it what it is during the pandemic. And the rates are also higher when schools are closed, as it happened during the pandemic, because the school can be that protective environment when there is something that doesn't go well in the family. And so that is why we have concentrated in trying to support parents in dealing with the stresses of the pandemic in a way that is not negative, and it's absolutely not negative against the children. And of course, I know that in many countries, many steps have been taken to provide girls, women, children with ways of reporting violence and being put in a safer situation even during the pandemic. And of course, those are absolutely crucial. In the long run, what will become very, very important is strengthening mental health services, because we are looking at adults and children and families that have been exposed to stressors in a long period of time during all of this pandemic, and this will result in higher rates of mental health disorders, including substance use disorders, and so we need to be prepared.
Thank you, Giovanna. I believe that it would be appropriate to have an ultimate concluding remark by each one of the participants, and I will be asking this in the order of that, of seeing you on the screen. Oh, Freedom, before you do that, there is a multiple request. Can they have access to the presentations? This is something to discuss after the webinar, and you will let you know of the platform of ISSUP. Fine, thank you very much, Natalia. Very well. So, Joanna.
Come on, Joanna, you are first. A closing remark, if you want.
Sorry, I was just unmuting. Thank you, Faydon. I want to say, really fascinating and in-depth presentations. Thank you to ISSUP Greece for putting that panel together, and thank you very much to our speakers. Thank you to the ISSUP staff who've helped us put all this together and obviously supported ISSUP Greece through to this point of launch. And good luck, and I look very much forward to seeing you all on these occasions and in person in the future.
Thank you. Ευχαριστούμε πάρα πολύ. Igor.
Do you hear me now? Okay, folks, again, thank you all very much. Let me remind you and remind myself, every issue, every challenge, every topic that we discussed today had existed prior to COVID. And unfortunately, it will exist after COVID as well. COVID made it worse, but I would not use COVID as an excuse for many things, for nothing actually. It just, the pandemic made our work more difficult, but everything we talked about pre-existed the pandemic. Like every crisis, there is no such a thing like permanent crisis. Every crisis is temporary. This crisis is temporary as well. So as soon as we'll get sane, normal, we forget about Zoom and we start meeting with each other and work with each other, we need to really strategize. What are we going to do globally around the world and in Greece specifically to reduce the burden and pressure on our patients? Because everything we do is we're doing for the benefit of our patients, not for our own. Thank you all.
Thank you, Igor. Thank you. Bobby.
Sorry, there is one question for Babis.
Δεν θα τελειώσουμε ποτέ όμως έτσι.
Okay.
Okay, κάντε όμως. Είναι και η σειρά του Πάπη να μιλήσει, οπότε...
Ναι, that's why I stopped. Γι' αυτό σταμάτησα τώρα. Ρωτάει ένα συμμετέχοντας σε μία...
The question for Babis is the following. When on the ETC, how do you substitute the lack of physical contact and the lack of true verbal contact? Natalia, please repeat. How do you substitute the lack of physical contact and the lack of true verbal communication? Babis is repeating the question, trying to understand the question in Greek. Well, as of an ETC, how can we make up for the lack of visual contact and perhaps the lack of visual messages we put through when there is no such physical contact? Well, imagine having a group where people are wearing masks. There are ways. Well, if the rules say we have 6 members with masks, how can we deal with that? Let me be more specific. Indeed, there are some difficulties. Many things may be happening when we take part in a therapeutic group through the internet. I may be in the group, but I may be doing other things. I may be playing with my mobile phone or anything. But it's all about the contract, you know. Under a therapeutic contract amongst all members, gradually people are bound to learn how to behave. Today, I had a major group of students, and we worked on the representation of a community setting, and we practiced on that. In the end, we delved into the discussion of interaction. We tried to improve it. And then we say, if we work in this context, we need to isolate ourselves. We should refrain from playing with our cellular phones, for example, forget sending about SMSs and the rest. And as for the physical contact, I believe they're talking about the physical contact in various communities. In many settings, there is no such physical contact anyway. It is not allowed to touch anyone. Let us not forget that. We may have seen people embracing each other. This is therapeutic, but there are other ways whereby to express emotions. Nevertheless, a kind of therapy, any therapy, is bound to have bring about benefits, but it's not a panacea. Let me conclude. As far as I'm concerned, this crisis might be an opportunity of sorts. There are many other resistances. My colleagues at the university have been under shock when they came to implement tele-training and tele-education. Many people resist. They just provided one-way training. They just use Skype as businesses. They give a lecture. People are left in suspense. Most of the students are out and off. They switch off the cameras and they do other things. And almost everybody says, okay, let's wait for this to be over, to come closer. Unfortunately, it doesn't happen like this. When professors are just giving a lecture without providing for the possibility to interact and actively participate, no, it doesn't work like that. He's hoping that will become better even through the internet.
Bill, any last words, any concluding remarks from you?
Bill, we have no sound. We can't hear you.
Can you hear me now?
Yes, we can.
Thank you very much. Very briefly, Phaedon, and to everyone in the ISSUP Greek National Chapter, I think this just shows what kind of contribution you're going to make to us using all the tools to what I think is, at least from our perspective, the most important thing, which is how does this affect the person suffering some substance use disorder, and how do we help the practitioner in the field? Thank you very much.
Thank you, Bill. Thank you for everything, not only for your participation today. Χρήστο, σε ακούμε.
Δεν έχω τίποτα να προσθέσω.
I have nothing to add to what Igor said. I fully endorse Igor's position, and that's exactly what I had to say. Problems we're facing now have existed before the crisis. Let us not use COVID as an excuse and an alibi to become passive and inert. Thank you, Christos. Thank you very much. Okay, Giovanna.
Oh, I thought I had already talked. But what, like Christo was saying, what Igor mentioned really resonate with me. It's true the pandemic made it worse, made our work difficult, made some issues maybe more relevant than others, but it cannot be an excuse, and actually it can be what will push us to do better, right? And to be really prepared for next time, next crisis, and to really put people at the center of our policies and work. The children, the youth. I am a preventologist, if these words exist, a poor translator. But of course, above all, also people who use drugs and people with drug use disorders. And this is why we are here. And this is why we should be here and do better. We are doing a lot. And my thoughts always go to the big families of ISSUP and how this is an opportunity to really exchange ideas and learn and get inspiration to improve. And from Greece to the world, from the world to Greece. And so I think congratulations to ISSUP Greece for being born in such a wonderful way and looking forward to working together.
Giovanna, thank you so much.
In closing, I would like once again to thank Olivia and Kirsten, as well as George Fasoulakis, the interpreter, for having interpreted for 3 hours in a row. I would like to thank all of our speakers. They were excellent. Thank you all for honoring us with your presence, and thank you all attendees for having followed this launching event. Thank you very much for being part of this webinar. We started with ISSUP Greece. Well, good luck to all of us. In IFAKI ITC, we say you may change, and indeed we need to network, and we need a kind of network like that of ISSUP to become better. We need to be better. We may be better. We can do better. Good luck to all of us. Good luck to Greeks and to all of you. And have a nice 3-day holiday ahead. Thank you very much.